in her PT, and we're going to demonstrate some of her active range of motion and stretching that we do. So she's up here on a plinth or a high-low table, and she's just kind of having a break out of her chair, and we're working on getting her body relaxed and aligned, and she's kind of doing some rolling side to side. And I'm going to help her come all the way over. The purpose is to get weight bearing through both sides of her body. And then while she's in a side lying position, she's on her right side right now, she's going to kind of move her arms a little bit. See if she can get some arm extension and also some shoulder flexion. And sometimes it helps Danielle to do this when she's moving. So as she goes to roll over to the other side, she gets that right arm up nice and high, beautiful. We're a little bit limited too by the size of the width of our table here, but we're just doing the best we can. Nice. Okay, then Danielle's going to come back to her back. And I'm going to give her a little bit of support to lengthen. So I'm going to slide her hips towards me a little bit. And then I'm going to reach under and I'm going to slide her shoulders. And then she's just going to relax her arms down by her sides. Good. And we're going to let's stay on your back for just a minute. And I'm going to help you kind of elongate, and we'll do some leg movement. And then we'll show how we work on your trunk, okay? Okay. So I'm going to come under Danielle's scapula, kind of back and behind her shoulders. And I'm just going to give her some gentle, we call this distraction, where I'm really just using my body weight and gravity, and I'm kind of not pulling, I'm just kind of gently tractioning to help elongate her spine and get a little bit more length through her torso. And ideally, then, we have more length and more symmetry. So I'm going to help now with my pelvis. So Danielle does not have full active motion of all of her muscles in her legs, and so she also sometimes needs a little bit more support, especially on her right side. So let's pause for just a second. I want to see if we bring Danielle's body this way. We're going to work on some upper rib cage mobilization. Danielle's kind of giggling because she, I think, enjoys this. I'm going to bring her hips towards me, and I'm just kind of helping her be as elongated and aligned as possible. And then Danielle has a scoliosis, and it's very flexible. So what it means is that her left side, her right side shortens, and it's rotated forwards. So that causes some asymmetry, and it affects how she sits, and then it affects her head control. So when we're out on the mat table, we like to get her nice and stretched out and as aligned as possible. So I'm going to put my hand, this is the front of her rib cage. It's kind of right about here. And I'm putting the flat part of my hand up against that. And I'm going to kind of scoop up and back. So it's like I'm kind of picking up her rib cage, and I'm bringing her back towards me. And what this does is it lengthens her torso. And then once we've got a little bit more alignment, that also helps with the possibility for some rib expansion and breathing into her lungs more evenly. So I'm just sort of passively positioning here, and I'm using my body weight kind of against the table to hold here, so I'm not working too hard. And then while we're in this position, Danielle's going to take some nice deep breaths. So with her mouth closed, which creates the most pressure, most abdominal pressure, she's going to breathe in through her nose, nice and slow. Good. And I can feel her belly expanding, which means that she's getting some activity in her diaphragm, which are her lower breathing muscles. Good. So nice deep breath in. Kind of try and push my fingers out. Good. And then exhale. I'm going to stay here for usually a couple minutes. And then we can get a little bit more extension with Danielle bringing her arm up over her head. And I'm just gently assisting. And then see if you can bring your arm back down again. Good. And then take it up. I'm going to tap her tricep to help with that elbow extension. And then I'm going to come over to her scapula, and I'm going to kind of push up and forward as I'm helping her rib cage back. And Danielle's good about letting me know if I need to give more pressure or if I've got it right. So how's this? Good? Okay. So I'm going to stay here for a minute. And you're just working on your breathing. You're just good. Oh, nice. That's a nice deep breath. So the goal is kind of slow, deep breathing. So if you think about breathing in for 3 seconds or 3 counts, so like a 1, 2, 3. So good, and then out. So in for a 2 or a 3 count, and then out. Better? So as Danielle does more deep breathing, she's actively moving her own rib cage. So as she loosens up a little bit and there's more space created, then I can come in and be a little bit more more directive, I guess, in how I'm positioning and how I'm moving things. So we get a little bit more movement. Nice. So today we don't have our pillows. Typically we would have a pillow between her knees to kind of help level her pelvis out, and then a pillow that we use up against her right hip for when she's lying in supine on the table to help support her right hip, which tends to sometimes be painful. So as we're in this side lying position, I'm going to come in and support Danielle's leg. And I'm going to ask her to do a little bit of active motion. So I'm helping keep the position of her upper body. I'm going to ask her to bend her knee and flex her hip and then straighten it. Push, 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 push. And all I'm doing is supporting and following. I'm not forcing or pulling. So Danielle, see if you can slow it down. See if you can that's it. Bring your knee up again and just hang there for a sec. And then out. And relax there for a minute. Here's where we're getting some hip extension and then hip flexion when she bends up. Good. I'm going to gently put her leg down. We're going to go to the other side. So now what I want you to do, we've mobilized her rib cage a little bit, gotten some trunk extension and elongation, and now we want to move a little bit. We want to use that motion. So I'm going to safely put this back up and ask Danielle to come back to her back. I think I might need to give you a little scooch over here so you have room to turn. Room to move. Do you feel good? Okay. So let's straighten you out a little bit. And then I'm going to give her a stretch through her shoulders up. Position you in the middle here. And I'm going to come in here and just kind of scoop her this way. Again, lengthening, and then I'm going to ask Danielle to put her chin kind of in the middle and just gently tuck her chin so she gets some elongation through her neck. Good. Is that good? Give you a little bit more. Don't worry, I won't pull you off the table. Okay, and then I'm going to come down to her pelvis and kind of give her a little movement that way. So she's just going to stay nice and relaxed. And I'm going to kind of bring her hips in the middle. And I'm just going to give her a little bit of traction this way. Do you feel that? So it's just a really gentle distraction or traction through her pelvis. I'm on either sides of her hips, and I'm kind of gently scooping down and up. So to get length this way, to help her low back. All right, so then in this position, I'm going to come around to the other side of the table, and we're going to give this side some attention. And I'm going to ask Danielle to bring her knee up. So she's flexing her hip and her knee. I'm supporting her right hip as we're doing this. And then she's going to stretch it back out. Push, 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 push. So nice long leg. Good. And then up again as you're ready. Good. And up again. And out. Good. So for somebody who's in a wheelchair much of the day, her position is compromised in kind of a chair position, really, because her hips are contracted and her knees are contracted. And so active movement is super important, and allowing her to move within what's comfortable with the range of motion that she has. Good. Okay, now so that we do treat both sides, I'm going to scoop you towards me a little bit, and I'm going to have you roll that way. Back in the middle. So really, because of Danielle's scoliosis and her curve and where her curve is, we get the most effective movement when she's lying on her left side and I'm working on her right side, bringing her back that way. So I don't spend a lot of time on this side because her curve is all this way. So we mostly work on this side and then work on elongation and supine, or lying flat on her back. And then this is a nice position for her to actively move her arms. Good. And get some extension through her upper back and her lower back and her head and her neck. She can turn, reach and rotate and just move in the positions she wants to move. Because if you look at her chair, it's really contoured to support her. So she's held in a pretty fixed position, which is what she needs so that she can drive her chair and she can use her stylus and communicate. And it helps keep her active and upright. But it's also important for her to get out of her chair and have time to move. So we will check back in a couple of weeks, and we'll work in a bigger space where you can see Danielle doing more rolling and more movement. Relaxed, and she's in a good position and ready to work.
Nice. Hi, this is Salome, Danielle's one-to-one, and I'm going to help her eat lunch. We've already put her bib and a towel down so no one gets dirty. Usually she has something pureed, something yummy, like carrots and raisins or rice and soup. Today, sweet and sour chicken? Sweet and sour chicken. Okay, here we go. So Danielle needs small bites. That helps. And she's a camera hog. Usually tilting her head back helps her swallow. And just clean her up a bit. And we keep going.
Do you want me to keep filming, Danielle?
I mean, because it's just more of the same.
Stop. Okay.
Hey, this is Salome, Danielle's one-to-one, and I'm going to help her eat lunch. We've already put her bib and a towel down so no one gets dirty. Usually she has something pureed, something yummy, like carrots and raisins or rice and soup. Today, sweet and sour chicken? Sweet and sour chicken. Okay, here we go. So Danielle needs small bites. That helps. And she's a camera hog. Usually tilting her head back helps her swallow. And just clean her up a bit. And we keep going.
Do you want me to keep filming, Danielle?
I mean, because it's just more of the same.
Stop. Okay. Do you want me to keep filming, Danielle?
I mean, because it's just more of the same.
Stop. Okay.
So with her Gatorade, just in a baby bottle. Clean her up a bit. And that's it with the bottle. So with her Gatorade, just in a baby bottle. Clean her up a bit. And that's it with the bottle.